Okay, so another question is effect of ACE inhibitors is ACE inhibitors causes release of angiotensin 1 and that convert into angiotensin angiotensin converting enzyme converts angiotensin 1 into angiotensin 2. So ACE inhibitors are given, they decrease ACE in angiotensin 2 and they increase renin and increase bradykinin, and that bradykinin causes the dry cough. So ACE inhibitors, angiotensin converting enzyme convert angiotensin 1 into angiotensin 2 and degrade bradykinin. This when blockers ACE inhibitors are given, angiotensin 2 is decreased and bradykinin increase. They cause dry cough and also renin is increased. That loss of negative feedback occurs, and the in this way the mechanism works. So ACE inhibitors decrease angiotensin 2 level in the blood, and that is dry cough will be there, and patient will have dry cough as well in ACE inhibitors. Another one is action of initiator of carcinogenesis is permanent DNA damage, causes irreversible DNA mutation, and it stimulates proliferation of mutated cells but does not cause DNA mutation. So in this way DNA damage results into uh, initiation of carcinogenesis. Next one is primary lymphoid organ is thymus. Primary lymphoid organ is thymus. Secondary lymphoid organ is bone marrow, lymph node, tonsils, and a malt as well. So this is the difference between primary and a secondary lymphoid organ. Now the hematopoiesis steps. Number first is pro-erythroblast, and then erythroblast, and then intermediate normoblast, then late normoblast, and then reticulocyte, and then comes mature RBCs. Now this is the lineage. Now what happens hemoglobin begins to appear at which stage it is early normoblast or basophilic normoblast. There is early basophilic normoblast, hemoglobin begins to appear, and then there comes polychromatic normoblast in which hemoglobin increase, and then late orthochromatic normoblast in which nucleus is extruded out of the cells, and then reticulocytes having highest HB level before maturation, and mature red blood cells are the final stage of the hematopoiesis. So in this way hematopoiesis is there. And the first lymph node involved in carcinoma tip of the tongue, that is submental lymph node, is the first one that is involved in the carcinoma of the tip of the tongue. And then lienorenal ligament, as we discussed in the previous one, lienorenal ligament contains vessels and tail of pancreas and splenic artery and vein, and also there is gastrosplenic ligament in which there is short gastric arteries are there. So Wernicke's area, patient having fluent nonsensical speech after road traffic accident, means no sense in the speech, that is Wernicke's area. And Broca's area, there is broken word, and there will be the non-fluent speech. In this way there is fluent speech, but that is nonsense, does not make any sense, that is Wernicke's area. So in this way you have to rule out whether speech is making sense or not, whether speech is fluent or not, whether speech is making any broken words or not, whether speech is making any comprehension or not, and which area of the brain is damaged. It is inferior frontal gyrus or the temporal lobe as well. So these things are very important to diagnose whether Broca's area is involved or Wernicke's area is involved. Next one is aortic root dilation triad. Aortic root dilation, lens dislocation, MVP. What is the diagnosis? It is inherited deficiency of fibrillin, and the diagnosis is Marfan syndrome, in which lens dislocation or lenticular dislocation we can say in Marfan syndrome. Now Bacteria with no cell wall is known as mycoplasma. Having no peptidoglycan in the cell wall does not affected by beta-lactam antibodies, because beta-lactam antibiotics causes destruction of peptidoglycan. In these bacteria there is no peptidoglycan, so no destruction is there. Now coming to the triad of the Philadelphia chromosome, BCR-ABL positive and myeloid cells are more in the blood, and also there is increased WBC count, that is known as CML, chronic myeloid leukemia. So in this way we have to diagnose the chronic myeloid leukemia. Another triad is coming. Patient have dysphagia, patient has white esophageal plaque, patient has pseudohyphae, that is known as candidiasis albicans. Pseudohyphae is characteristic sign and common in HIV, diabetes and steroid using people. So you have to prevent these three things in your life. You have to prevent HIV, you have to take care of your body for prevention of diabetes, you have to prevent steroid usage to prevent candidiasis and oral white esophageal plaques. Next one is, in hemostasis term, gain refers to the exaggeration of negative feedback, and gain is means ability to feedback the system, and a higher gain is more effective negative feedback system. Now there is neck vein distension, jugular venous distension from right atrial pressure exceeds more than 8 centimeter of water or the 6 millimeter of mercury. This is the thing to memorize that you have to keep in the mind. Now, as we already discussed, the ACE inhibitors causes dry cough due to accumulation of bradykinin, and more renin will be there and no feedback mechanism will be there. Another one is action of initiator in carcinogenous damage of the DNA, but that damage is permanent damage, and it is for always. When initiators produce irreversible genetic mutation and carcinogenesis develops. Primary lymphoid organ is thymus, secondary is the tonsils, the Peyer's patches, and the malt, and the things like that. Now here comes the favorite one in asthma. Asthma is restrictive lung disease. In restrictive sorry, it is obstructive lung disease. Obstructive lung disease, there will be increase in functional residual capacity, increase in residual volume, increase in total lung capacity, and decrease in FEV. While in restrictive lung disease there is restriction to the inspiration, and then there will be decrease in the capacities, there will be decrease in compliance of the lung, and decrease in the functional residual capacity. Another one is posterior inferior limit of the lung is at 18th rib. Mid-clavicular line is 6th rib. Surface anatomy. Mid-axillary line is 8th rib. And supraparavertebral line is 10th rib. This is posterior inferior limit of the lung at 10th rib.